Mr. Louis was found unresponsive and on the sidewalk next to fine wine and good spirits. Decent vitals, no head trauma.
Didn't we just discharge him a couple hours ago?
Yep, stone cold sober at 7 a.m.
Oh, God, don't light any matches.
Hey, Doc, how you doing?
Not as good as you, Louis.
Hey, you know it, Doctor.
How much did you have to drink, Louis?
Just a couple of shots of vodka.
Just remember that if someone's drinking a lot heavily for a long period of time, if they abruptly discontinue drinking, they can develop something known as delirium tremens, which can lead to seizures, extreme discomfort. So you want to usually give these patients a medication, commonly a benzodiazepine, usually Librium. I believe we saw it in one of the earlier episodes.
So like a half gallon?
Oh, hell no. Just a quart.
But one of the effects that drinking has that most people don't think about is not just on your liver, but on your heart. Alcohol can predispose you to cardiomyopathy, where your heart becomes weak and is not able to function properly. And as a result, you can destroy your heart from drinking too much.
He's got Librium from this morning.
That's what I prescribed him.
Oh, he was literally there a few hours ago.
You prescribed 20 Librium, there's only 10 left. Shouldn't we be concerned about an overdose?
Oh, no. Vodka is Louis' drug of choice. Quickest way to kill the shakes.
True that.
Where'd the other 10 pills go?
I don't know. Maybe lost, stolen. Maybe sold him to buy the vodka.
What'd you do with the other pills, Louis?
In my pocket, I didn't need them. Come on.
It's so hard to know what's happening in a situation like this. He's clearly inebriated. You don't know where he came from. It is possible that he is selling the medications, but their interactions being weird.
Been trying to check the nursing notes on Louis from 7 a.m. this morning. Langdon ordered lorazepam, but I don't think it was given.
Yeah, lorazepam ordered, dispensed, and then returned unused to the PDS per Dr. Langdon as patient's tremor had resolved.
Is that unusual?
No, happens all the time.
You think that could be the vial I couldn't open on our seizure patient?
Possibly.
Can we check the other vials in the PDS, make sure they're okay?
Really want to?
I do.
All right, come on. The log shows me we have 5 vials left. Take one out, and now we have 4 left. But if I click that I want to return one unused, you put it back, and the computer count goes back up to 5.
Yeah, same lot numbers, everything looks good.
No way of knowing which file was returned by Dr. Langdon.
Yeah, I guess. Thanks.
Yeah.
Why is she so sus of everyone? She's hitting up patients without knowing all the facts, doing the same with her colleagues. Like, as a resident in training who's already having a rough day, I would probably put more focus on myself rather than on everyone around me.
Old man coming in with a heart rate of 30. Sounds like pacemaker failure.
Oh, pacemaker failure is interesting because generally pacemakers are put in for someone who has bradycardia. Bradycardia is when you have a slow heart rate, because the way that I remember that is Tom Brady. Tom Brady is slow, so bradycardia. There's a condition called heart block, which can cause actually pauses in your heartbeat. This is an electrical abnormality that by putting in a pacemaker, which usually sits externally with leads or wires going into the chambers of the heart, that send an electrical signal in order for your heart to beat. And usually this is done through what we call demand pacing, so that if your heart's beating normally, it's fine, but if it senses the heart is pausing so that you don't syncopize and faint, it actually sends an electrical signal to remind your heart to beat. And you'll actually see that representative on someone when you get an EKG. You see these specific lines representing pacemaker spikes.
Willie Alexander, 81, near syncope from the Memory Day Center. They said he's more altered than usual.
Pulse is 30, BP's 80/40. No change with a mig of atropine. He's got a pacer in his chest, but there's no capture.
So in a situation where there's no capture, if the pacemaker seems not to be working, we do something called a pacemaker interrogation, where we actually see what the pacemaker is reading and what signals that it's putting out. Obviously, you could do external pacing, but that's usually temporary until the pacemaker itself is corrected. And usually when we are able to control a pacemaker, it's done with the rep of the brand of the pacemaker. So we actually have to call the company and have them send someone out. Sometimes we have even a magnet device that we can put over the pacemaker in order to activate or deactivate it.
Pacemaker patient with dementia. Heart rate of 30, little altered with a systolic at 80s.
31 on the monitor.
Dr. Javadi, what do you think of that heart rate?
It's not beta blockers, so junctional escape for them.
Exactly, common with a non-functioning pacemaker. Etiology, Dr. Mohan?
Dead battery or lead failure?
Indeed.
So basically they're trying to rule out what's causing his low heart rate. In a situation like this, it's more pointing to the pacemaker failing, which could be that it just turned off, or the leads/wires have been displaced from their original location. And sometimes they go into one chamber and sometimes they go into two chambers, and it's considered biventricular pacing.
What's next, Dr. Lang?
We can try percutaneous pacing, but eventually we'll need transvenous.
So that's what we just talked about, where you could pace someone from the outside. So you'd put those defibrillator pads on and you could do skin pacing.
Systolics up to 95 with the epi.
It's too low.
Let's start a drip, 2 mics per minute. Check the mental status.
He knows his name. Sir, do you know what year it is?
It's 20-something.
So in order to make sure that he's perfusing his vital organs, including his brain, you need to be able to ask some questions. However, in a patient who already has established dementia, it makes it that much more difficult. So you ask him a question, you don't know, is it because he has poor circulation to his brain, low oxygen, or because of his pre-existing medical condition?
Rocco DiGiulio, amputation of the fourth fingertip at the base of the nail, bone exposed.
Oh.
How'd this happen?
I crushed under an air conditioning unit we were installing.
We'll numb up your finger. One shot will help with the pain.
Amazing.
Digital block, 3 cc's of Marcaine.
So when they say a digital block, that means they're gonna numb up the nerve from all sides of the lower portion of the finger in order to create no sensation distally from that point on.
Any drug allergies, sir?
2 grams of cefazolin.
They're trying to put an antibiotic on board as well because it's likely an infected wound.
Ooh, wow.
Oh, okay. I was looking at a different part. Wow. Okay. So we're missing the complete distal portion of the poor finger.
Pinprick and some burning.
Where's the missing piece of skin?
It's, under a 1,000-pound unit. It's flat as a pancake.
Well, then we have nothing reattach. Plan, Dr. McKay? Bone rongeur VY flap. Exactly.
Awesome. I picked the right case.
I'm surprised they're doing that and not a hand surgeon. To me, this is like instant call hand surgeon and control patient's pain, infection, and bleeding.
To close the wound, we're gonna trim down the bone, then use a plastic surgery trick so the skin will cover everything.
Okay.
Your finger's gonna be a little shorter, no nail.
Great.
I mean, he had to have expected that if he saw that his finger was fully crushed.
10% off manicures.
That's a good joke.
Do you feel any pain?
No, that shot worked great.
Okay. Like this. How far down?
Just so the sub-Q will cover.
The sub-Q is a subcutaneous tissue, so you want to be able to cover the bone and protect it. Because remember, skin is a protective barrier. It protects you from infection, it protects you from sun damage, so you need to be able to flap the skin over the wound.
What do you think, Dr. Giovanni?
3rd degree, complete heart block.
When you have heart block, you can have different degrees of heart block. You have to distinguish which type it is because your intervention is going to be different depending on which type of heart block it is. Now, if a patient already has a pacemaker, odds are that it was probably 2 or 3 heart block because he needed this type of intervention. With 1, you rarely are getting pacemakers, especially if you're asymptomatic. Now, in a situation like this, you're going to have to fix the leads or fix the pacemaker in order to get it functioning again.
Heart rate is 30. This low BP is going to make him a lot more confused.
Could cause a heart attack or a stroke if we don't fix it.
Oh, well, mystery solved.
The wires aren't even touching.
I'm totally disconnected. Shit happens.
Heart rate still in low 30s, no change with atropine.
Pacing pads are on.
We can try. Willie, your pacemaker isn't working.
We gotta fix it.
We're going to try to pace your heart from the outside. You might feel it in your chest. Let's start at 10 milliamps, rate of 60.
Pacer on.
Oh, twitch it.
No capture.
Increase to 20 milliamps.
That's more like a shock.
Still no capture.
Up to 30.
Oh, y'all trying to electrocute
Pacer off.
me?
Can't tolerate it.
Get rid of this shit.
Dr. Langdon?
One of Verse said, can we set up for transvenous?
So they're going to sedate him a bit in order to go through his veins in order to reach the heart.
Versette's on board. We need to float a temporary pacemaker from your neck into your heart.
Where is that?
Because your heart rate is only 30.
And hit me with a shot of atropine.
You've already had 3. Wait, are you a doctor?
He's asleep.
Bam. Internal jugular accessed.
Pulse ox 99 on 5 liters. Systolics 95 on epi.
That's good enough to perfuse the brain. Guidewire?
So they're putting in a central line here that will then give them access and allow them to pace through the vein into the heart.
I could use some air.
Is that any better?
What y'all doing?
We're putting a temporary wire into an external pacemaker until you can have surgery to repair the one in your chest.
Heart rate's still 31.
Bradycardia.
Are you a doctor, Willie?
Yeah, right.
No mention of any medical career in his past records. Just mild dementia.
Oh, you a doctor. That was a good one.
Looking good. Check the pulse.
Strong radio, really strong.
Man, I feel like I just woke up.
Nice work, Dr. Langdon.
Systolic's up to 130.
You just have to remember in a situation like this is a temporary solution. You actually have to go in and fix those leads.
Amber Phillips, 6 years old, found at the bottom of a home pool with an unknown downtime. Asystole on the monitor.
The asystole on the monitor means we should be doing chest compressions. I guess they kind of are. With a drowning victim, though, obviously they're in a hospital situation already, but if there is a drowning victim that let's say you find at the beach, you would immediately do chest compressions and rescue breaths because in a situation like that, you don't know how long the person's been out. And likely they don't have any oxygen in their lungs to perfuse their blood. So in a situation like that, again, 2 breaths, chest compressions, chest compressions, chest compressions.
Intubated with a cuff 4.5, 22 gauge left AC, 0.25 epi 3 minutes ago.
1, 2, 3.
I don't like those chest compressions again. I should have brought this up to Noah when he was here. I'm surprised I didn't.
Fast and deep.
Yeah, see, they're even critiquing his chest compression.
Ready?
Yeah.
Go.
She's really cold.
Okay, get a cord tub.
They're pushing a little bit too fast on that bag.
Rectal temp only 85.
What do you think, Mel?
She's cold, moderate hypothermia.
We need to get her up to 90 if we have any chance of restarting her heart.
250 cc's heated saline.
So usually warming blankets, heated saline, these are all ways to start increasing body temperature.
Time for another epi.
God, those chest compressions are the reason you can't bring this child back.
My wife and I decided we're on board with organ donation.
Oh, I'm really glad to hear it.
The church supports their decision.
The OPO is sending an ambulance.
I'll be staying with the family.
How's it going in there?
Oh, not good.
Robbie, for the little girl in trauma 1, this is grandmother Frances and sister Bella.
Hi, I'm Dr. Rabinovich.
How is she?
Bella, would you like to color? Maybe get a snack?
Yes, please.
My name's Kiara. Let's find you some crayons.
I like to draw.
Let's do it. Come on.
They are still doing CPR.
Can I please see her?
Yes, of course.
I would warn the grandmother that what she would see would be very graphic.
Go.
Here you go, ma'am.
Oh my God, those chest compressions are so bad.
She wasn't breathing, so the medics put a tube in her throat.
She's so cold.
We're warming her up. That way she'll have a better chance to respond to the medicines.
The fact that she's been without oxygen to her brain is devastating. We're talking about, I don't know how many minutes. Even since they brought her into the hospital, at least it's been 10, 15 minutes. And 10, 15 minutes without oxygen to the brain with some poor chest compressions, a lot of brain damage is likely to have happened.
What's up, party people?
VY flap.
Nicely done. Can I borrow Dr. Santos?
As long as Dr. McKay can finish the dressing.
Sure. Can't stop thinking about your foot.
I like that she washed her hands immediately upon leaving the room, washed her hands going in, and washed her hands going out.
Crohn's disease status post-colectomy 10 years ago, now with severe abdominal pain.
Could be perforation, fistula, obstruction.
Great teaching case.
Colectomy is basically they remove the colon, and in a situation like that, when you have post-surgical changes, one of the big things you need to consider are obstructions as a result of adhesions forming, because in a post-surgical abdomen, you have a higher rate of forming adhesions, which are basically scar tissue that wrap around the intestine and create a blockage.
Someone give me something for the pain!
Good afternoon, Miss Walker. I'm Dr. Garcia from surgery. This is Dr. Santos and Javadi. It's like you're in a lot of pain.
No shit.
We ordered you some morphine.
Did you read my chart? I'm allergic to morphine. I'll puke my guts out.
That's a side effect, not an allergy.
Give me some Dilaudid.
Okay, 1 milligram Dilaudid.
Dilaudid is a same opioid medication as morphine, but stronger, so you need less of it. So 1 milligram of Dilaudid is approximately 7 milligrams of morphine.
I can't take it much longer.
Dr. Shomsky on speakerphone from the OR.
Did they really go and get another surgeon from the OR because the patient is demanding it? I don't think that's how it works.
Hi, honey.
Minimal relief with 2 of Dilaudid.
She needs 4.
That's what I've been telling them.
We're titrating. We didn't want her to stop breathing.
Is Dr. Garcia with you?
Right here.
How's the exam?
Rigidity with guarding.
So rigidity, you could have a rupture of the anastomosis that they created, the connection that they created within the gut when they took out the colon. And as a result, you could have fecal content spilling into the abdomen. You could have spontaneous bacterial peritonitis, where you're having a bacterial infection inside the peritoneum in the abdominal cavity.
Sounds like peritonitis.
You like that pause?
2 sets of blood cultures and 3.375 of Zocin.
Zocin is an antibiotic that we use for gram-negative bacteria, which is very commonly what's seen inside the colon. When there's bacteria living inside your gut, it's different than the bacteria actually entering your abdominal cavity. That's not where they're supposed to be.
I have something unusual to ask.
Okay.
I've been on 2 cases with Langdon, and there have been irregularities with benzos. Lorazepam with a seizure, Librium with an alcoholic.
And?
And I'm concerned.
Concerned about what?
That he could be stealing?
Whoa, whoa, whoa. I insult the shit out of Langdon, but he's a great doctor. I've never seen him impaired.
What do I do?
You've been here for what, 7 hours? Just do your job.
I mean, I would ask a few more questions. Every time, this is even like a mistake I sort of made in one of the other reviews when they're deciding what to do as mandatory reporters. Like, if there are signs of something going on, you don't just brush it off and say no big deal. You have to investigate, you have to report to the authorities. In a situation like this, you should feel comfortable going to a superior and explaining yourself.
Sorry.
That's an acute abdomen showing peritoneal signs.
Sorry, just to review, no fever, no vomiting, no diarrhea, no constipation.
Correct.
You want the last bowel movement as well in a situation like this?
When exactly did the pain start?
10:15 this morning, all of a sudden.
That's very strange.
I agree.
Will you tell me everything you did this morning?
Took a shower, had breakfast, some coffee, toast with jam, yard work, moved some firewood.
Did the pain start before or after the firewood?
A little bit after.
What's the tie between abdominal pain and firewood?
I might have got a splinter in my foot. I wasn't wearing socks. Other one.
Two small puncture wounds, 1 millimeter apart.
Are we diagnosing a spider bite?
Whoa.
What?
There's a dead black widow spider in your shoe.
A recluse?
Red hourglass marking.
We need IV diazepam. Start with 5. Might need 10.
I don't know anything about black widow spider bites, but I assume it's serious. And she's giving a benzodiazepine, I guess a muscle relaxer.
What does a spider bite have to do with my Crohn's disease?
Oh, nothing.
Crohn's disease is inflammatory bowel disease that can cause bleeding, GI disturbances, and it's an autoimmune condition.
Black widow venom can cause muscle spasms in the belly. People have had surgery thinking it was appendicitis.
Hi, Dolores. Why didn't you get her to CT yet?
I don't think she needs it.
The abdomen is rigid. She's perfed.
Maybe not.
Why didn't they just do an ultrasound real quick and see if she's perf?
What are you giving?
Diazepam.
I didn't order that.
I did.
You can't order diazepam as a med student! She's a med student, right?
She has a rigid abdomen, but no other GI signs or symptoms. It didn't make any sense. There's a black widow spider and a bite mark on the foot. The venom is causing spasm of the abdominal wall musculature.
Whatever you guys gave me, it's working.
Possibly.
No, definitely. I'm much better.
Yeah, the one point that she did a good job finding here is that there was no fever. If you're having spontaneous bacterial peritonitis, this is a bacterial infection that makes you sick very fast. So in a situation like that, you experience a very high white count and a very high fever, or at least a fever. And she didn't have that, so good thinking outside the box.
My mercury level is 94. That's high enough to cause all your symptoms.
See, this is why I don't know what happened with Robbie, that he was fighting ordering this panel. It seemed a very reasonable thing to do.
From a stupid face cream.
Face cream, supplements, all things that are untested and are coming from other countries especially, you have to be suspicious of, which is why, unless it's very clearly proven, manufactured in a really good quality facility, usually pharmaceutical grade, I try to stay away from it.
We're gonna start chelation therapy. It's a medication that binds with the mercury and helps your body excrete it.
Chelation therapy in this situation is obviously indicated, but people will do chelation therapy as a form of scams, basically doing it for everybody, irrespective of what their levels are, sometimes not even checking their levels, just saying that we all have high levels and you should all be checked. It's really become a scammy thing, because if you scare a patient, you say, oh, there are heavy metals in your blood, I'm gonna get them out. It sounds to a regular person like you're doing something positive, but if you're doing it without an indication, you're just scamming people.
Robin, here to T1. This is Dr. Robin.
Where's Amber? Is she okay?
What have you heard? She got pulled from the pool. She wasn't breathing.
It's good that he right away tried to figure out what they know so that he's not surprising them with too much information too soon, but also not repeating information that they already knew.
When we're trying to get her heart started again. Wait, her heart stopped?
I have to be with her.
Of course. There are a lot of people in here right now trying to help her. I understand.
Amber. Oh my God, Amber. I love you. I love you so much. I am so sorry.
Okay, come on, just
The pacing on the ambu bag is better now.
Rhythm check, hold compressions.
Remember, every 2 minutes is a round of compressions, at which point you check the rhythm and see if they are responding.
Asystole, resume compressions.
3 minutes since the last epi.
Push another.
Did you shock the heart?
No.
Why didn't you shock the heart? We've got to say, you got to shock the heart.
Heart rhythm right now is flatline, and that's not treatable with a shock.
You don't shock asystole, you give medications during an asystole. Asystole is the flatline rhythm that you see in the heart, because what the defibrillator does is it stops the rhythm in case there's an unstable one and allows the heart to restart naturally the correct rhythm. But if there is no rhythm, you're not really restarting anything. So on all these other medical dramas, when they run in with defibrillators, when someone's flatlining, I'm like yelling, why are they doing it? For this exact reason.
We're trying to get the rhythm to change to something we can shock by warming her up.
Okay, so we got to warm up. We got to get some more blankets in here or something.
We're giving her warm IV fluids, and you can feel these blue pads. They have warm water running through them like a hot tub.
Those chest compressions, man. Not even making contact with the chest. The child's not even an actress anymore. You could put a mannequin there and serve the same purpose and allow at least 2 chest compressions. Man, come on.
Hi, I'm Dr. McKay.
Piper.
Laura.
And you guys are...
She's my boss.
Oh, what kind of work?
I'm an accountant and she's my assistant.
Oh, cool. Piper, are you okay with your boss being here while we talk?
Yeah, I'm good.
Are you sure? I'm gonna be asking you some pretty personal questions.
She doesn't mind. We have no secrets.
You'd want the patient to answer, not the person with the patient.
So burning with urination, when did that start?
About 2 days ago.
Why don't we let Piper answer the questions?
I'm sorry, it's just we've been waiting so long.
About 2 days ago.
So in a situation with burning on urination, obviously your first thought is to think about urinary tract infection. If it's spreading upwards, creating flank pain, potentially a pyelonephritis, which could be a complicated urinary tract infection. But there's also things like kidney stones and vaginal infections that can cause those types of symptoms.
You from Pittsburgh?
2 hours north, like Mill Village.
Okay. You have any family you want to call?
I don't have a phone.
She can use mine if she needs to.
This is the weirdest interaction. I don't understand if this is a boss, if this is a loving relationship, an abusive relationship. See, what I would do as a doctor, because I like my little strategies, is I would step out of the room, pretend like I got paged or something, leave, ask my social worker to come talk to the patient. But I would have the social worker wait until I asked to speak to the boss. And then the boss would come with me and I would ask them to talk, and they would love to talk because they want to talk to the doctor. And then while you're talking with the doctor, you're having a social worker talk to the patient.
Any pain around here?
Mm-hmm. Suprapubic tenderness, pretty consistent with the urinary tract infection. And by the way, urinary tract infection could be as a result of E. coli bacteria in the urine, but urinary symptoms like that could also be caused by an STI, gonorrhea, chlamydia, because they can cause urethritis. Also could be pregnancy, obviously. You always want to check that.
You gave us a urine specimen?
Hours ago in the waiting room.
Okay. Well, I'll find the results and then you might need a pelvic exam.
Is that really necessary?
It could be. If there's no bladder infection, it's important to check.
Okay.
And if we do a pelvic, Laura will have you step outside for a minute.
I prefer to stay with her for support.
Piper, do you want some privacy?
No, it's cool. She can stay.
Okay. Right, I'll be back.
Excuse me, Dr. Robbie. This is Eli, son of Willie Alexander.
Hey, nice to meet you.
Likewise. How's he doing?
He's doing better. He's gonna need to stay with us, though, for a new pacemaker.
He got a new one at Presby about a year ago. They said it'd be good for 10 years.
Yes, but the wire's separated from the box. It happens sometimes.
Can he have a visitor?
Of course, right this way.
Hey, Eli, what did your dad do for a living?
Postal worker, 40 years.
Did he ever do any volunteer work at the hospital?
No, but when he was a kid, he was a medic for the Freedom House ambulance service.
I believe Noah mentioned this to me, where this was the first volunteer ambulance service in the nation. Let's see if my memory serves me correct.
Guy's a legend.
I know. Sorry, can I get your help with something?
Yeah.
18-year-old woman with dysuria, moved here 2 months ago from rural Pennsylvania. She's with her female boss, who's very controlling and answers questions for her, won't leave her side for anything, even a pelvic exam.
And you're thinking?
Red flags for trafficking.
Sounds like it.
I mean, trafficking, but there's so many unknown variables. Like, my thought in a situation like this would be something isn't adding up, let's separate and see what happens. And just go in open-minded. Because it could also be a normal relationship that you and I might not understand.
Some of your tests are concerning for a kidney stone.
Would that give more pain?
Not always.
If it's a urine infection with a stone, you'll need to stay in the hospital for some IV antibiotics.
That's not true. So I don't know if they're just lying to get more information. Depending on the size of the stone, you might just get Flomax, a smooth muscle relaxer to help pass the stone, increased hydration recommendations, and a follow-up with urology or your primary care doctor, especially if it's non-obstructing.
This is where you do the CT?
No. We wanted to give you some privacy for your pelvic exam.
Laura's gonna be so pissed.
Why would she be mad?
Piper, you have any concerns you want to talk about?
No, just the pain when I pee.
Anything you need to tell us about your job or your boss?
No, it's all really great.
But your urine test was positive for chlamydia.
Shit.
It's a sexually transmitted infection. You need antibiotics twice a day for 10 days. That'll clear it up. You should also test for HIV, syphilis, gonorrhea, and hepatitis.
I'm surprised they didn't automatically test for all those things.
Piper, we have a question that we ask everyone. Sometimes people are pressured to have sex when they don't want to. Does that ever happen to you?
No, never.
When you signed in, you put down Laura as your emergency contact.
Yeah.
You have the same address as Laura.
Yeah, she's letting me use her guest room until I can save up for a place of my own.
Okay.
What are you doing there, Willie?
Nothing.
You're moving your old pacemaker.
Diagnosis made.
What?
Twiddler syndrome.
I didn't know that was a name. No way. Or is he making that up?
Spinning that thing around caused the wires to break off.
Dad.
I didn't mean to.
Well, it's okay. We'll put the new one in a little deeper. Won't happen again.
So remember, the pacemaker sits right there underneath the skin, so it is accessible to some degree.
Freedom House took us in and trained us for 300 hours.
They turned out the very first medics in the United States.
There we go.
Started IVs, defibrillated, intubated in the field.
They were the heroes of Hill District.
Everything that Willie and his friends did set the EMS standard for the entire country.
I love that they brought in the EMS workers for this conversation.
Temp is up to 91. She's so much warmer. It's working.
Well, the warmth is working, but the heart's still not.
Can you shock the heart now?
91 is warm enough for her heart to respond.
Oh, compressions.
Not on flatline.
Asystole.
Resuming compressions. Got the potassium level back, 12.2.
When cells rupture, potassium gets released.
No one has ever survived a cardiac arrest with a potassium over 11. There is absolutely no chance of recovery. I am so sorry. Amber has died.
Call the end to the compressions.
Before we stop, do you think her sister would like a chance to say goodbye?
No, Bella shouldn't see her like this.
Okay.
That's a fair question and a fair answer.
You can stay in here for as long as you like.
It's okay. It's okay.
We are going to stop now.
You have to stop chest compressions called time of death, as well as turning off all the alarms so that they stop beeping, causing anxiety for the family.
Discontinued 1451.
Oh, sweet. Sorry.
Can I see Amber now?
Not quite yet.
What is that?
Oh, it's from the gift shop.
For Amber?
For you and for Amber. But you get to name it.
I think her name will be Bear.
All right.
I like that name.
If you tell Bear everything you want to tell Amber, then I'll take Bear and sit her on Amber's pillow, and then she'll tell her everything you said. What do you think of that plan?
I like it.
Yeah? Okay. Do you want to give it a try?
Hi, Amber. It's me, Bella. Thank you for saving me. When you come home, I promise I won't touch your toys without asking. And I try not to fight because you're my best friend in the whole entire world. I love you.
Amber's gonna be so happy with that.
Yeah, this is weird now that you're creating this dialogue between them and the parents haven't yet told her. This can get quite tricky.
Thank you for everything.
Look at how much death is dealt with on just one shift.
I wish I could do the surgery here.
Surgical teams are flying in from all over the country to meet Nick at the Center for Organ Recovery.
So we won't be seeing you again?
The answer is hopefully not, because I'm an ER doctor, and if you are seeing me, it usually means someone's sick. The human heart actually has a pretty bizarre history. Click here to check that out, and as always, stay happy and healthy.